If your child's heart condition is no longer responding to medical treatment, a heart transplant might be recommended. It's not a cure, but could be an option to prolong survival and improve quality of life. A heart transplant means your child's sick heart will be surgically removed and replaced with a healthy donor heart. To determine if a heart transplant is the best treatment for your child, a heart transplant evaluation will be scheduled by your doctors. The evaluation may be completed during your child's admission to the hospital, or it may be done as an outpatient, depending on your child's medical needs. You'll receive a lot of information about heart transplant during the evaluation. At this time, a transplant coordinator will help guide you along the way. A member of the transplant team will discuss the evaluation process with you in detail and explain the benefits and potential risks of the tests. You'll be asked to sign a consent form for the evaluation process to begin. The evaluation will assess your child's overall general health, emotional status, and support system. It will help the transplant team determine if a heart transplant is the best treatment option for your child's condition. The evaluation will also help the team develop the best plan of care for your child before and after transplant. Evaluation testing may include a complete medical history, including a review of vaccination records, a physical examination, laboratory studies, chest X-ray, CT scans, cardiac catheterization, echocardiogram, electrocardiogram, abdominal ultrasound, vascular ultrasound, and additional testing depending on your child's gender, age, past medical history, and current health status. The evaluation will also include consultations by members of the multidisciplinary care team, as well as education sessions by transplant team staff members. After the testing and consultations are complete, the transplant team will determine if a heart transplant is the best option for your child. A member of the transplant team will meet with you to discuss the team's recommendations and answer any questions you may have. If a transplant is recommended, your child's information will be placed on the National Waiting List for Heart Transplant, which is managed by the United Network for Organ Sharing, UNOS. UNOS uses your child's blood type, age, weight, height, and other medical information to find a donor heart that will be a good match. Status on the list is determined by how urgently your child needs to receive a donor heart. It's based on how advanced your child's heart failure is and how much medical support is needed. Your transplant team will discuss with you in detail what this means and what status your child is on the transplant list. When a potential donor heart becomes available for your child, you will be notified by a transplant coordinator who will give you further instructions. You need to be available by phone 24 hours a day so that the transplant team can reach you at any time. Once a donor heart has been identified and time for the transplant operation has been determined, your child will be prepared for surgery by the medical team. Your child will not be able to eat or drink anything before the operation. The nurses will collect blood for lab work, and additional tests may need to be performed. While your child is being prepared for surgery, the medical team monitors the donor's condition as well. A surgeon from the team will visually inspect the donor heart before bringing it back to Children's of Alabama to be transplanted. Please know that there is a chance the surgeon will decline the donor heart based on visual inspection. However, rest assured that your child will remain eligible for other donor hearts if this happens. The surgeon or physician will discuss the surgical procedure with you in detail before the operation to explain the potential benefits of the surgery as well as the risks. You'll be able to ask the surgeon or physician questions, and you'll be asked to sign a consent form for heart transplant at this time. You'll stay in the waiting room during your child's transplant surgery. A member of the operating room staff will periodically update you throughout the surgery. Once the transplant is finished, your child will be transported to the Cardiovascular Intensive Care Unit, or CVICU, for close monitoring by doctors, nurses, and other members of the transplant team. Here, your child's medications will be adjusted frequently. The surgical incision will be monitored, and pain will be managed to help your child recover from surgery. After becoming more stable, your child will be transferred to the Cardiac Care Unit, or CCU, to continue recovery and prepare for discharge from the hospital. In the CCU, members of the transplant team will educate you about taking care of your child's new heart. And there's a lot to learn. The decision to receive a heart transplant is a major one and should not be made without a great deal of thought for several reasons. Transplantation is a major surgical operation that involves some degree of risk to your child. Specific information about the risks and major complications associated with the surgery will be discussed with you during your child's evaluation. Having a heart transplant requires a serious commitment by the entire family to maintain a strict post-transplant regimen of diet, medication, exercise, and clinic visits that must be followed for the rest of your child's life. Your child's diet may restrict calories, fluids, salts, fats, cholesterol, and carbohydrates. Many families find that following the strict regimen requires changes in their lifestyle. All the medications prescribed to your child are necessary and must be taken at specific times. Follow-up appointments with the transplant team are important and expected. During these visits, your transplant team will perform tests and adjust medications to make sure your child's new heart remains healthy. Attending these visits is necessary to prevent potential complications. The medications your child must take after the transplant have certain side effects that can be unpleasant and can cause other medical problems. Some of the medications that prevent your child's body from rejecting the new heart can also decrease the ability to fight off infection, can raise blood pressure, cause high blood sugar and/or diabetes, damage to the liver and kidneys, and can increase your child's risk of developing certain cancers. During the evaluation process, you'll learn more about other possible drug side effects and potential complications. And please remember that not all patients will have the same side effects. Our hope is that your child will be able to live an active and productive life after receiving a new heart. The transplant team here at Children's of Alabama will work closely with you and your family to teach you what you need to know to help your child live successfully with a heart transplant. If you have any questions, please contact your transplant coordinator for more information.